Question number 3 of our panel. What are the opportunities and the challenges in creating a coordinated care organization here in Columbia County? Where are we starting? Let's start with Brady, and we'll work this way, and then come back over here.
Could you explain what coordinated care is?
Yeah, State of Oregon just passed in the last legislature the concept of coordinated care organizations as a way of delivering public health services, particularly to the Oregon Health Plan recipients. And so each of the counties is now submitting applications for coordinated care organizations throughout the state of Oregon. So maybe I'll start with Earl, because I think you've been involved in this, and then we'll go from there.
You expect me to answer this? Which one? This one. You expect me to answer that question in 60 seconds or less? I've been working on it for 60 months. It seems like it, at least 6 months. Matter of fact, we had a meeting this morning at 8:30 this morning. There was a joint meeting at the community Columbia Mental Health to talk just about that. As a provider who wants to put an application in, we'll put an application in on Monday for a CCO. There's tremendous challenges because you're trying to take a system that's been built up over decades and change it, the fundamental way in which it operates. What they're trying to do is to take Medicare and Medicaid, as well as Oregon Health Plan folks, and put them in a managed care system that is capitated, that is only X number of dollars, and you have to manage those dollars to take care of all the folks. Very challenging process. We're not sure how the governmental structure will work. Counties have certain legal responsibilities that they have to carry out, yet the CCOs may or may not be directly responsible to the counties. We're not sure how all that's going to work, being built on the fly. Very complex system that the state is trying to introduce to drive down the cost of health care. So whoever gets this position is going to have to really take some time to understand how this system is envisioned to operate, and to put the time in to deal with it. It is extremely complex.
Let's go back to
Honestly, I don't have a lot of background on this because it sounds like it's a work in progress. What I will tell you is that I know that Columbia County does have some major service issues, and if this helps to solve some of those problems, hallelujah. We have issues with mental health, we have issues with Medicare and Medicaid, we have significant problems in our community with GOBI pass-through funds. And I don't know how many of you know this, but if you have a child in this community that needs any sort of therapeutic foster care or anything that's just a little bit more than what your typical child would need in the mental health care system, they get shipped out of our community. And that's a great way to break a family down even farther. When you have a family that's already broken generally and you have a child that needs some significant mental health care services, they can get shipped out of our state. You don't fix families and you don't build healthy communities when you are shipping your children away from home. And that is a major part of this problem, and I'm sure it ties all into this coordinated care organization piece. I think that if these things are going to happen and they work, they will be amazing, because there's a lot of work that needs to be done here.
like Colleen, I'm not real familiar with this issue, but I do know from past experience that people working together can work out difficult situations, and Earl said this would be very difficult. If you just get the community working together, and that's difficult enough, but you get the state and the federal and everybody else in the county working together, I'm sure that there's going to be some really big challenges. But I've had big challenges in the past, and if elected, I'm ready to take this on. Some questions I would have would, who would have the final say once this is all said and done? And the other question I would have would, how will it affect, bottom line, the care of the people that we should really be concerned about? So those would be my questions, but I'm sure they can be answered, and people can work together. I've seen it happen before.
As it's a fairly new program, the information I have is the stuff I've read. My interest, of course, is related to my work that I've done with the mentalhospitaltax.info people. That basically, we're not the only county, as bad as I think that we mishandled that whole process here in our county. We're not the only ones that have done that. In other counties, they have also had similar issues of accountability in the public health delivery systems. And the governor is basically, because of his medical background, is saying that he wants to do it on a state level rather than a county level, is my understanding. And I think it's a great idea. I think that the counties are struggling already to deliver those services. I think that there's a huge disparity in how the services are doing within our local county. I mean, if you talk to the people in Vernonia or Pascaline, they feel very underserved by the public health that is here in St. Helens. And to have it come down from the state program, I think is a great idea. And I hope it actually comes to fruition and it works.
The CCO, are we on? The CC. Let's try the This isn't the streamer. The CCO concept that Governor Kitzhaber, Dr. Kitzhaber, took to Washington, D.C. was, he basically went to Washington, D.C. and said, look, we would like to be the test case for the whole nation. And we would like to do a new system. We'd like to develop a new system for healthcare delivery where we treat something other than the symptom. We'd like to go to the root cause. And he basically said, look, if you give us, the state of Oregon, $2.5 billion, we will over a decade save the federal government $10 billion in Medicare and Medicaid by amalgamating services all the way from mental health, veteran services, public health, and privately managed service into one system. And the system where you really go at the root cause rather than the symptom. I mean, for example, we heard today, I guess it just flies in the face, but it's typical bureaucracy. You cannot, with Medicare and Medicaid, go in the same day and get mental health and physical health appointments. Now, I said, okay, what happens with a classic case? You slash your wrist. You're going to get sewn up and you clearly need some mental health. Do you have to wait a day for one or the other? This is a way to change, a paradigm shift to change healthcare as we know it today. It's a big, big task. I don't know if we can get there, but it's pretty exciting. And we have an application to be on that cutting edge in Columbia County.
The CCO concept is an excellent concept. It's how we get there that's going to be the struggle. And I don't think us as candidates are going to have much say in that because most of the deadlines are already set and most of this program is going to have to be in place or it's too late and cuts start happening in the Medicaid and the Medicare. So it's critical to get moving fast, which they are doing. I've listened in on the conversations. The concept of preventative care to keep them out of the emergency room is part of the driving force behind it because emergency room care is the most expensive care you can get. So managing that, as long as we don't let it slip like some of the private healthcare providers that we know of in the past that had these type of programs, the care of people has got to be the number one priority. Driving down the cost is the side benefit. And I think the bigger the program, the more savings just in supplies, everything. That there's lots of ways that can team up to make the best program to deliver medical services. But I agree with them. It's got to be done carefully. And like I said, most of this stuff is going to have to be done before we would ever take office. So it's the ongoing managing of that process once it happens to maintain some local control.
Well, everybody's just about commented on everything I wanted to say, so I think the CCO was a positive change, and I think that the managed care system would save money, like everybody's been saying, for preventative care, well baby care. That's a lot of dollars in the long term, and I think it would be providing better care for more people. With the savings that it would have, it could spread the care to more people that is in desperate need of medical treatments in this economy.
I'm gonna say that I don't know much about the CCO, but with the Medicare things that's going on, is it should be basically kept separate until I can get more information on it, how it's gonna work, how it's gonna affect all the people that is on these programs. So we have to look at the whole picture of this